Chapter 5, Digestive System. So here we're going to be talking about the different structures, functions, and terms involving the digestive system. So looking here, you have the digestive system. Here's a big visualization of the digestive system. You can see, starting from the oral cavity all the way down to the anus, this is referred to as the alimentary canal, which is the primary structures of the digestive system. It consists of the mouth, the pharynx, the esophagus, the stomach, the small intestine, large intestine, the rectum, and eventually the anus. Okay, so the alimentary canal is this hollow tube that extends from the mouth and the anus. And it's really important because it facilitates the movement, digestion, absorption of food. Okay, however, there's also accessory organs of the digestive system. You have the teeth and tongue, which aid in mechanical digestion in the mouth, salivary gland, which secretes saliva to begin chemical digestion. You have the liver, big production of bile for fat digestion. Gallbladder, which stores this bile and concentrates it. The pancreas also plays a big role in generating in the production of digestive enzymes and hormones, as well as chemicals to neutralize acids. These organs are not part of the alimentary canal itself, but either project into it or secrete liquids to assist with this digestive process. So let's look at defining the following root elements. So aliment refers to nourishment of food. Digest means to break down food into simpler form. Gaster or gastro, which is the combining form, relates to the stomach. When we look at here, the digestive system, we need to know the essential functions. You have ingestion, the process of taking food and or liquid through the mouth. Propulsion, the movement of food through the digestive tract, right? This can be through either swallowing, deglutition, peristaltic, which is wave-like muscle contraction. You have digestion, breakdown of food, whether it's chemically or mechanically. Secretion, release of either digestive enzymes, acids, bile production, mucosal secretion. Absorption, which is the transport of nutrients from the digestive tract into the bloodstream or lymph for distribution to the body. And then elimination, expulsion of indigestible substances and waste products through the process of defecation. All right. Here, one thing to note is the difference between chemical and mechanical digestion. Mechanical digestion involves physically breaking down into smaller pieces without altering the chemical structures. Example, chewing, mastication, and the churning that occurs in the stomach. Chemical digestion involved with breaking large food molecules into smaller, simpler chemicals through the activation of enzymes, acids, and bile. For example, starch is broken down into sugar by amylase enzymes. Word analysis and definitions. So you have the word amylase. Root is amyl. Definition is an enzyme that breaks down starches into simpler monosaccharides and disaccharides. Deglutition. Root, deglut, to swallow. Deglutition is the act of swallowing. Elimination. So the root is eliminate, to expel or remove. This process is the expulsion and removal of indigestible substances and waste from the body. Peristalsis. Root element, peri, around, plus stalsis, constriction. So this looking here is basically these rhythmic contractions, these wave-like muscle contractions that propel food throughout the digestive tract. Here, let's look at the mouth. So the mouth is where digestion begins through chewing, mastication, and mixing with saliva, as well as there's a high concentration of salivary amylases and lipases that chemically break down sugars like starches and fats like lipids or triglycerides. The foods then move from the mouth through the pharynx. Another name for the pharynx is the throat, and are propelled into the esophagus, which transport it into the stomach. So looking here, you have the mouth and mastication. So let's use this figure to highlight the key structures of the oral cavity. So you have the teeth, tongue, buccinator muscle involved with chewing, palate, and uvula all work together to facilitate chewing, swallowing, and beginning the initial stages of digestion. Buccinator muscle, located in the cheeks, serves as essential functions in order to keep food in place in the mouth while you chew. This ensures food is properly positioned for efficient breakdown. You have the palate, which forms the roof of the mouth, is divided into the hard palate, comprised of anterior 2/3 and supported by bone, and provides a rigid surface against which the tongue presses food. You have the soft palate, made of muscle, it forms the posterior 1/3 and plays a crucial role during swallowing. Uvula, lastly, hangs from the soft palate and has an important job during swallowing. It closes off the nasopharynx to prevent food or liquid from entering the nasal cavity. Here, let's look at other structures. So you have different parts of your teeth, right? So you have incisors that cut into foods. You have cuspids, punctures, and tear foods. Bicuspids that grind and crush foods. You have the molars that grind and crush foods, okay? And when we look at it, what are the two parts to every tooth? They have a root and they have a crown. Bulk of the tooth is made of something called dentin that is highly vascularized. The pulp, which is deep, is where a majority of the blood vessels are actually found. The actual pulp is where you're going to have blood vessels and nerve ending as well as connective tissues. You're also going to have different types of glands. You're going to have salivary glands, specifically that create saliva. There's three regions. You have submandibular, below the mandible, sublingual, below the tongue, and you have the parotid. The parotid basically can be found by the temporal bone. We look here, let's look at root elements, defining the following root elements. So you have a cusp, which is a root element, which is for point. So cuspids are canines, which is designed for puncturing and tearing foods. Gingiv, which is the root for gums. So for example, gingivitis is the inflammation of gums. Okay. Odont, which means tooth, right? So orthodontic, which refers to the correction of irregular teeth alignment. You have salive. Salive refers to saliva, and in this case, salivary glands, the glands that are responsible for producing saliva. Deglutition, what is that? That is the process of swallowing. All right, so once food is properly chewed through mastication, chemically and mechanically digested, it needs to get transported as a new polymer or molecular element. We call that bolus, down the throat and through the esophagus, through a process we call deglutition. And these have different phases of deglutition. You have the oral phase, where the food is basically pressed against the roof of the palate. You have the pharyngeal phase, where the food enters the pharynx or the throat. You have the esophageal phase, which basically goes and enters the upper esophagus and begins with these rhythmic peristaltic movements in order to enter the fourth phase, what we call the gastric phase or the stomach phase, where it enters the stomach for additional chemical and mechanical digestion, right? So you can see all the different phases here, right? So you have the oral phase, you have the pharyngeal phase, the pharynx, the esophageal phase, and the gastric or stomach phase. Now, looking here, looking at digestion, we're going to be focusing on the stomach and small intestine. Here, you have digestion primarily in the stomach. So in the stomach, you have these peristaltic waves in the stomach that mix food, or as we call this new food, this new terminology called the bolus, by mixing it with stomach acid. And the special type of acid we call hydrochloric acid. When it mixes together, it's called chyme. And it begins to move towards the pylorus, which is the opening of the small intestine. Now, when we look at the stomach itself, stomach has a variety of cells and secretions. You have mucin, which lubricates and protects the stomach lining, this mucosal secretion. You have hydrochloric acid that's responsible for digestion and breaking up ingested food, this bolus, and creating an acidic environment for immunity. You have pepsinogen, an inactive protease that breaks down protein, right? So when it becomes activated by hydrochloric acid. You have intrinsic factor that's responsible for basically taking up vitamin B12 for red blood cell formation. And also, you have to realize you have these chemical messengers that are responsible for stimulating other cells, right? So you have pepsins, hydrochloric acid, which is again aids in the digestive process. Let's look at suffix analysis. When we look here, define the following suffix. So here, we look at it referred to structure or tissue. So duodenum, part of the small intestine. In refers to a substance, right? Pepsin, a digestive enzyme. Gen refers to something that produces or creates. Pepsinogen, the precursor to pepsin. Us definition refers to structure or thing. Mucus, a protective secretion. So these different suffixes will have their own terminology. Now, let's look at the small intestine. The small intestine, actually here, will be broken down into three segments. The three segments are the duodenum, jejunum, and the ileum. The duodenum, or duodenum, is the first 9 to 10 inches, basically 1 foot, where pancreatic juices and bile enter to assist digestion. This is primarily majority of chemical digestion occurs in the body is in the duodenum. Jejunum makes up 40% of the small intestine, is primary site for chemical digestion, but mainly for absorption. This is where absorption begins in the small intestine. Then you have the ileum. Ileum comprises of 55% of the small intestine. And again, it is going to connect directly into the large intestine. But again, here you're going to have primarily absorption that takes place. We look here at word analysis. Well, I want you to find out the adjective forms. So the jejunum would be jejunal. So jejunal ulcers. So basically these ulcers found in the jejunum. Mucosa is going to be mucosal. So mucosal inflammation would be a term, an example. Peritoneum will be converted to peritoneal, right? So peritoneal fluid, which is fluid that lubricates the organ within the abdominal cavity. And then you have serosa, which will become serosal. Serosal tears, which can occur during abdominal surgery. Okay, so these are different examples and practices that I want you to do in order to prepare you for understanding these terminologies. So when we look at chemical digestion, absorption, and transport, the primary biologic molecules that are digested and absorbed here are going to be carbohydrates, proteins, lipids, and minerals. Minerals, examples of that would be salt, sodium, potassium, calcium, magnesium. Here, when we look at absorption of carbohydrates, carbohydrates can come in various forms. They can be polysaccharides, which are basically multiple of these sugar molecules. For example, starches found in foods like bread, rice, and potatoes. Disaccharides, two simple sugars. So in this case, it'd be like sucrose, table sugar, and lactose, like sugar found in milk. And you have monosaccharides, simple forms of carbohydrates such as glucose and fructose found in foods like fruits and honeys. Digestion of carbohydrates, one thing to look at is polysaccharides and disaccharides. They require a specialized type of enzyme secreted from the pancreas. So, for example, these polysaccharides needs pancreatic amylases to break down these polysaccharides into simple sugars like glucose. And then disaccharides, like for example, sucrases or lactose, they also require enzymes to break it down. So disaccharides are actually transported to the liver where they are converted into glucose, the body's primary energy source. Here, when we look at absorption in the small intestine is the primary location for not only chemical digestion, but absorption, primarily through these microvilli, these villi and microvilli that are going to be responsible for increasing surface area. When you increase surface area, you have the highest probability of transporting these biologic molecules like proteins, lipids, waters, for example, as well as minerals. Let's look at some root elements. I want you to define the following root elements, okay? Amine is basically nitrogen compound or amino acid. So in this case, amino acid, a building block of protein. You have hydro, which is basically relates to water or fluid. So hydration, the process of maintaining adequate water levels in the body. You have carb, refers to carbon compound, particularly in the carbohydrates. So carbohydrate is a source of energy made up of carbon, hydrogen, and oxygen. So you have lact relating to milk or lactose. So for example, in this case, lactase is an enzyme that breaks down lactose. You also have what else? Now, looking here, let's focus on the large intestine. So large intestine is the next structure after the ileum region of the small intestine. The cecum is responsible for connecting the large intestine to the small intestine. Cecum is this pouch-like segment that connects the ileum to the small intestine, primarily the ileum to the large intestine. The next region of the first region of the large intestine, we call that the ascending. So you can kind of see the part of the intestine starting from the right side is going to be called the ascending. It travels upward on the right side of the abdomen. Then it crosses to a region called the transverse colon, right? So it runs horizontally across the abdomen. Then you have the descending colon on the left side that travels downward on the left side of the abdomen. And then you have the sigmoidal colon, which is this S-shaped segment leading to the rectum. Rectum is primarily responsible for storing feces before expulsion. Lastly, you have this anus. Anus is the sphincter, this opening of the colon that connects the colon to the outside through this passageway. Let's look at some functions of the large intestine. So you have absorption. So it's primarily responsible for absorbing nutrients, water, and electrolytes. Digestion. So it releases certain chemical or digestive enzymes, acids, mucus, bile secretions. So one thing to look at when we look at large intestine is there's not as much digestion that takes place. It's primarily the digestion takes place in the small intestine. What else? You have peristaltic movements that takes place that are these rhythmic contraction. And lastly, it's going to be elimination. Elimination is going to be removal of indigestible substances and waste. So more terms to define. So colon, major portion of the large intestine responsible for absorbing water, electrolytes, and forming feces. Colic is basically referred to as severe abdominal pain caused by intestinal or other organ spasm. Flatus, intestinal gas expelled through the anus. Flatulence is the presence of excessive gas in the digestive tract, often causing discomfort or bloating. And flatulent describes a condition or individual experiencing or characterized by the expulsion of flatus. Digestion here. Let's look at liver, gallbladder, and the pancreas. Here, these are the accessory organs, as we mentioned before. So here, what is the main function of the liver? Liver has a lot of functions. Manufacturing and excreting bile, removing bilirubin from the bloodstream, removing excessive glucose from the blood and store it as glycogen. It releases glucose from storage when it's needed, converts proteins and fats into glucose, stores fats and a lot of fat-soluble vitamins like A, D's, E's, and K's. It manufactures It manufactures blood protein, especially needed for clotting, and it removes primarily also it's responsible for removing a lot of toxins from your blood. Liver has its own blood supply from the hepatic artery and the portal vein. Blood is returned from all the intestine into the portal vein. This allows for liver to absorb and store vitamins, glucose, and fat, and to manufacture proteins that require to remove any kind of detoxification. These liver cells also secrete bile through a large duct called the hepatic duct. The duct then connects to the liver, either to the small intestine or to the gallbladder duct. Although the liver does not digest food, it sends bile and enzymes to the small intestine to aid in food digestion. So it is involved with that process within tandem with the pancreas. Word analysis and definitions. So define the following root elements. You have chole, which is referring to bile. So cholecystectomy is surgical removal of the gallbladder. You have emulse, which refers to suspension or dispersal. Emulsification, the process of breaking down fats into smaller lipid droplets. Hepato or hepat refers to the liver. So hepatitis, inflammation of the liver. Gluco refers to glucose or sugar. So glucose is a simple sugar used as a primary energy source. So here, when we look at digestion, gallbladder is primarily involved with the gallbladder and the biliary tract. Okay, so remember, gallbladder and the biliary tract are primarily responsible for storing and concentrating bile that's produced from the liver, right? So liver makes it, sends it either to the small intestine or sends it to the gallbladder for storage and further concentration. Here we have the pancreas, right? So the pancreas is located on the upper left abdomen. The head of the pancreas is encircled by the duodenum. So you can see here from this image. The pancreas is divided into three sections. What are they? The head, the body, and the tail. Most of the pancreas secretes digestive juices, which are excreted through the pancreatic duct. These specialized type of cells, these pancreatic islet cells, also secrete hormones, primarily insulin and glucagon, which are responsible for regulating blood sugar. And finally, this figure basically demonstrates. Now, one thing to understand is that the pancreas also secretes a base called bicarbonate. The reason is the stomach, when it combines the acid and the enzymes with the bolus, and it creates this new molecule called chyme. Chyme has a very, very low pH. In order to neutralize the pH, the pancreas provides bicarbonate to neutralize it. So when we look at the pancreas, you have exocrine, endocrine functions here. So the exocrine glands secrete primarily the digestive enzymes. So enzymes would include like amylases for sugars, lipases for fats. You have trypsin, chymotrypsins for proteins that are going to be primarily there. You have these alkaline substances, basic substances from the pancreas that are called sodium bicarbonate. And also you have endocrine gland function, as mentioned before, which are involving the secretion of insulin and glucagon in order to regulate blood sugar. Word prefixes. So these are very straightforward word prefix I want you to find. So mono means one. So monocyte, a single white blood cell. Disaccharide, two. Excuse me, di means two. So disaccharide, which would be 2 units of sugars. Poly, meaning many, polysaccharide, multi numbers of carbohydrates. Exo, meaning outward. So exocrine, glands that secrete outwards. Lastly, let's talk about the disorders of the digestive system. Now, here, the digestive system can be characterized by these various groups. And I'm going to define each individual one of these, right? So common issues of the digestive system usually can be either characterized by acid reflux or GERD, IBS, ulcers, or some kind of gastroenteritis. So the symptoms vary depending on the condition, but these include pain, bloating, or changes in bowel habits. So different terms here for food intolerance. Food intolerance is the difficulty digesting certain foods. So lactose intolerance, for example, would be an example here of inability of having the proper enzymes to break down the sugar or the disaccharide lactose. Food allergies. So food allergies here is where the immune system becomes hyperactive when it's exposed to a certain type of food. Example, peanut allergy. If you have a peanut allergy and if it's severe, this can become dangerous, leading to symptoms like hives or even anaphylaxis. Now you have IBD, irritable bowel syndrome. Irritable bowel syndrome is a functional disorder causing bloating, cramping, and altered bowel habits. IBD is inflammatory bowel disease, which include Crohn's disease, an autoimmune disease that attacks the small intestine, or ulcerative colitis, which is an autoimmune disease that creates ulcers in your colon. These symptoms of the IBD include diarrhea, abdominal pain, weight loss, malnutrition. Now, these different types can also be related here. Now, we have slower digestion that reduces these productions. Now, other examples of gastrointestinal bleeding that are provided here. So, gastrointestinal bleeding, there are different types. So, you can have upper GI bleeding from esophageal, stomach, or duodenal. So, this could be either ulcers or varices or lower esophageal bleeding, okay, from the colon, rectum, and the anus. This can be characterized by either hemorrhoids or diverticulosis. Symptoms include, for example, black stool or bright red blood in the actual regions. Now, looking here, let's determine certain words. So here, these are different characteristics of for the pathological problems of the digestive system. So, for example, you have from the previous slide, you have black tarry stool, which is called melena. You have hard infrequent bowel movement. What is that called? Constipation. You have not visible to the surface is referred to as occult. Right? So these are different types of words that's really important for this. So the passage of black tarry stool or hard or infrequent bowel movements, right? So again, it's important to define these terms when you want to basically create a diagnosis for these different diseases of the gastrointestinal tract. Here are disorders of the mouth. So I'm going to go through these. So you have plaque is a sticky bacterial film on teeth leading to decay of the gums. Dental caries, cavities, tooth decay is caused by bacterial acids eroding the enamel. Stomatitis, inflammation of the mouth lining caused by pains and redness. Cold sores, these are fluid-filled blisters around the lips, usually caused by herpes simplex 1, HSV1. Thrush, a fungal infection due to candida. Leukoplakia, what are white patches on the mucosa, often precancerous. Oral cancer, which is a malignant growth in the mouth or throat, often linked to tobacco or alcohol use. Halitosis is a persistent bad breath, often from either poor oral hygiene or systemic conditions. Glossodinia, burning sensation on the tongue without visible signs. Cleft palate, this is a congenital disease where there's a split in the roof of the mouth affecting speech and feeding. Usually some kind of surgical intervention must be provided for it here. Nord's syndrome, this is an autoimmune disease caused by dry mouth and dry eyes due to reduced gland secretions. So here, let's look at diseases of the esophagus. You have esophagitis, inflammation of the esophagus. This can be due to some kind of reflux, infection, or irritation. GERD, gastroesophageal reflux disease. This is a chronic disease where stomach acid backflows in the esophagus, causing heartburn or irritation. Hiatal hernia. This is basically a propulsion of the stomach through the diaphragm into the chest cavity, often leading to some kind of GERD or reflux. Esophageal varices are these swollen veins in the esophagus, typically due to liver disease with a risk of severe bleeding. Cancer of the esophagus. These are malignant tumors that are highly deadly and often linked to smoking, alcohol, or some kind of chronic GERD. Okay, let's look at disorders of the stomach. Gastritis. This is inflammation of the stomach lining caused by infection or alcohol or certain medication. Peptic ulcers, so these are sores in the stomach or duodenum, where is usually caused by a special type of infection called H. pylori infection or non-steroidal anti-inflammatories. Gastric ulcers, these are specific peptic ulcers located in the stomach lining which cause pain and potential bleeding. Then you have gastric cancer. This is a malignant tumor of the stomach, often associated with H. pylori, smoking, or some kind of high salt diet. Let's look at disorders of the small intestine. So gastroenteritis, inflammation of the stomach and intestine, which cause diarrhea, vomiting, abdominal cramps, and often due to infection. Celiac disease, autoimmune disease. This disease is actually triggered by gluten, which causes damage to the small intestine and malabsorption of nutrients. Intussusception. This is a condition where one segment of the intestine telescopes into another, causing blockage and reduced blood flow. Ileus. This is a temporary lack of intestinal movement leading to obstruction, often followed by some kind of either surgery or illness. Okay, these are disorders of absorption. So, for example, malabsorption, what is that? This is a group of diseases in which small intestinal nutrients is impaired. So, malabsorption, when the food intake absorption is insufficient, then this can lead to a lot of different problems, right? So we talked about lactose intolerance. So it's basically some kind of sensitivity or intolerance to milk. Crohn's disease, constipation, gastrodysentery. These are all different characteristics of these gastrointestinal diseases that can lead to problems with malabsorption. All right, now we have disorders of the large intestine. So you have appendicitis. This is inflammation of the appendix, often cause pain on the lower right side of the abdomen, and it requires an immediate surgical removal, right? Because you have the colon, which is primarily composed of bacteria. If that ruptures, people can have some kind of sepsis. That's going to be a problem. Diverticulosis, this is a formation of these small pouches we call diverticula in the colon wall. And often, usually they don't have symptoms unless they become infected or they become ruptured. Ulcerative colitis. So this is another type of IBD. It's a chronic inflammation of the large intestine that leads to ulcers, which can cause diarrhea, abdominal pain. You have irritable bowel syndrome, a form of reversible gastrointestinal disease, excuse me, which is basically where the functional bowel disorders cause bloating, cramping, and diarrhea, and even sometimes constipation. You have polyps, these abnormal growth, usually that are benign, found in the colon and the rectum, some of which develop into cancer. You have colon and rectal cancer. You have these are specialized type of malignant tumors in the colon and rectum that can be associated either to the polyps, genetics, or lifestyle factors. You have obstructions, which are blockade. These are blockages in the intestines which prevent normal passage of content. Intussusception, so basically one segment of the intestine telescopes into another, causing obstruction and compromised blood flow. And you have proctitis, inflammation of the rectum lining, causing pain, bleeding, and diarrhea, often due to infection or some kind of IBD. Here are disorders of the anal canal. So you have hemorrhoids. These are swollen veins in the rectum or anus causing pain or itching and bleeding. You have anal fissures. These are small tears in the lining of the anus, often caused by pain and bleeding during bowel movements. And then you have anal fistulas. These are abnormal tunnels between the anal cavities, the anal canal and the skin, often resulting from infection or some kind of abscess. Disorders of the liver. So you have hepatitis, inflammation of the liver, usually due to virus, alcohol, or toxin, nowadays sugar. Cirrhosis, this is chronic liver damage, usually due to alcohol use, which leads to scarring and a loss of liver function. Cancers, so you have liver cancers. These malignant liver cancers are usually linked to this. Hemochromatosis, this is a genetic disease where there's an excessive buildup of iron in your liver and other organs. Hyperbilirubinemia. This is an excessive production of bilirubin levels in the blood, leading to some instance of jaundice or yellowing of the skin or the sclera of your eye. And it's indicated of some kind of liver or bile duct issue. Then you have Wilson disease. This is a genetic disorder causing copper accumulation in the liver, brain, and other organs. You have disorders of gallbladder. So gallstones. Gallstones is hardening of a hardened deposit of bile component in the gallbladder, which causes pain and potential blockage. Okay. You have cholecystitis. This is inflammation of the gallbladder, usually due to the gallstones blocking the common bile duct. We talked about jaundice. There's three different variants here. You have obstructive, hemolytic, and hepatocellular. Obstructive is caused by a blockage. Hemolytic is due to excessive breakdown of red blood cells, overwhelming the liver capacity to process bilirubin. And hepatocellular jaundice. This is resulting from liver damage, reducing the liver's ability to metabolize and excrete bilirubin. You have disorders of the pancreas. So you have pancreatitis, inflammation of the pancreas, often caused by gallstones, alcohol use, or infections. Pancreatic cancer. This is a malignant tumor in the pancreas, often with poor prognosis due to late detection. You have diabetes, primarily diabetes mellitus type 1 and type 2. Type 1 requires insulin. Type 2 is usually resistant to insulin, leading to either high blood sugar production. You have cystic fibrosis. This is a genetic disorder affecting the pancreas and other organs caused by a thick mucus buildup, leading to the digestive and respiratory issues. Next, let's focus on some procedures and pharmacology of the digestive system. So here I have common diagnostic procedures that are used to test for gastroesophageal diseases, right? So fecal occult blood tests, so basically just looking for blood in the stool, to looking at for some kind of GI bleeding or colorectal cancer. Nasogastric aspiration and lavage. This is a procedure used they use a tube to remove stomach content or wash out the stomach. Barium swallow or barium meal or barium enema. This is a imaging test using barium contrast to visualize the esophagus, stomach, or the intestine via X-ray. Endoscopy tube, that is a flexible tube that has a camera that examines the upper gastrointestinal tract. Endoscopy basically is examination of the anus and lower rectum. You have flexible sigmoidoscopy. So basically, this is going to be looking primarily at the sigmoidal colon. Colonoscopy is a medical procedure used to look at primarily imaging of the colon. Gastroscopy is looking primarily an endoscopy of the stomach and upper intestine or the proximal intestine, so like the duodenum. You have pancreatic endoscopic ultrasound. So you have this procedure which is combined endoscopy and ultrasound to visualize the pancreas and the surrounding structures. And then you also have a digital rectal exam. This is a physical examination of the rectum using a glove finger to check for any kind of abnormalities. You have other therapeutic procedures, laparoscopy. Laparoscopy is a minimally invasive surgical procedure used camera and small incision to examine or treat abdominal organs. Intestinal resection is a surgical removal of a portion of the intestine, often due to disease, blockage, or some kind of cancer. Bariatric surgery is a weight loss surgery that alters the stomach or digestive tract in order to reduce food they take for people that have some kind of obesity or metabolic disease. You have the ERCP, endoscopic retrograde cholangiopancreatography. This is basically a procedure that combines endoscopy and x-rays to diagnose and treat bile and pancreatic duct disorders. Let's look at some suffix meanings here. So you have eon, which is process or action. This example, digestion, the process or of breaking down food. Osis, condition, often abnormal or diseased. Cirrhosis, a disease condition of the liver. You have ectomy, surgical removal. So appendectomy is the surgical removal of the appendix. And then you have stomy, which is creation of an artificial opening. So colostomy is a creation of opening of a colon through an abdominal wall. So pharmacology here. So we're looking at pharmacology. So there's different medication that they use to treat these gastrointestinal diseases. So antacid, these are medications used to neutralize any kind of stomach acid. So any kind of heartburn, indigestion, right? So examples would be like a calcium carbonate. Histamine 2 receptor antagonists. These are drugs that reduce stomach acid production by blocking histamine receptors in the stomach. You have proton pump inhibitors, PPIs. These are medications that significantly reduce stomach acid by inhibiting the proton pump in the stomach. So classic example is omeprazole. You have laxatives. These are drugs used to promote bowel movements to treat constipation. You have antiemetics, so drugs that prevent any kind or prevent or reduce nausea and vomiting. You have antidiarrheal drugs, are medications that reduce diarrhea by slowing intestinal movement or absorption of excessive fluids. Here, I want you guys to practice these abbreviations and definitions, and I'll go through them. GERD, gastroesophageal reflux disease. H2 blocker is histamine 2 receptor blocker. PPI, proton pump inhibitors. Now I want you to define the following terms: antacids, a medication to neutralize stomach acid. Gastroscope, a flexible tube with a camera that visualizes the stomach. And pancreas is a gland, is an organ that has exocrine and endocrine function that are responsible for regulating blood sugar and digestion of chemical material.